This video is being prepared for the Eastern Mediterranean University medical students. We will be performing the pelvic examination, and I will review for you the screening pap smear and the bimanual examination. We will be using a model behind me, and I'll review the different components of the exam, but I also encourage you to look in your Introduction to Clinical Skills guide for the checklist for the different steps you will be required to learn for this examination. So we start with getting informed consent from our patients. What does this mean? This means that we explain any procedure we're going to do, the benefits and potential risks of a procedure, and make sure that our patient understands these potential risks and asks their questions, and then gives us consent to do any procedure. And this includes any surgical procedure, or it could be any examination. We need to keep in mind that every patient has had different life experiences, and some positions or some parts of the exam are particularly sensitive and may put a patient in a vulnerable position. And this exam in particular is one in which we want to exercise care and sensitivity, utmost respect for patients of many different backgrounds, understandings, and potential trauma history. So let me review with you what I do when I am going to do a pelvic examination. And I won't go into the specifics of getting the informed consent. That's not part of this video. But I want to review with you what I do in terms of my workstation and making sure that I have everything in place. So near where I will be doing the examination, I prepare all the items I will need for the examination. And this includes a couple of different sizes for a speculum, the pap prep material, culture swabs if I need to do a culture, or swabs to look at vaginal secretions under the microscope. So everything is right next to me in a place that's easily accessible, which will minimize the interruption that I will need to have in order to complete the examination in a very sensitive and efficient way. So I will show you what I have in terms of what I've prepared as we're doing the examination. The patient is in a lithotomy position with their legs in stirrups, and they scoot down to the edge of the bed. And then we want to make sure we're covering the patient in such a way that preserves their modesty. So you uncover the area in which you need to in order to do the examination, but there's no need to not have the patient draped. Patients are often draped. So here's a drape that I have over our model. And when we use models can be quite stiff, so it's a little bit artificial compared to the human body, although patients can also respond with some sensitivity that may make the exam difficult. We never want to force the speculum examination or examination of the cervix. We always want to have sensitivity and pay attention to cues the patient might be giving us, either verbal or with facial grimacing, that suggests that they're uncomfortable. So this is part of any examination, but in particular for the pelvic examination. These instruments are called speculum, or speculi for plural, and they come in metal, which are sterilized. They can be reusable, or in plastic form, which are discardable. They come in many different sizes and shapes, but if we want to simplify that, we can say small, medium, and large, which speaks to the diameter of the instrument, but also to the length. And every patient is a little bit different, so you might have to use different instruments. But in general, if an average size person, a medium can be appropriate size to use. There are also pediatric size speculi for children, use in children, but also for more petite women that may require a pediatric speculum, or for someone who's having a difficult time with the exam and we need to use something smaller. These are a couple of examples of different brushes we can use, and there are other types of instruments as well, but this is just for you to look at. And what these are used for is to collect cervical cells from the cervical os for our pap smear. Your checklist indicates that we put the cells on a slide. We actually don't do that anymore. We use a thin prep material right here, and we release the cells into this solution, and then that's sent off for evaluation by a cytologist, and the cells are looked at to identify any abnormalities. In addition, we do HPV screening, which can be done out of the collected cells from this pap material. This is a handy cotton tip applicator you can use to collect any vaginal secretions. You may have larger cotton swabs to use to take away maybe copious vaginal secretions or any bleeding. Having a few of these available for preparation of slides, where you might want to look at the slide after the examination under the microscope for any bacterial or yeast overgrowth. If we do that, we use a KOH prep, potassium hydroxide, or normal saline, and we drip it on the slides, the separate slides that we prepare to look for either bacterial vaginosis or a yeast infection. Here's some lubricant we use to make the process easier, and our gloves. We want to have gloved hands, of course. Now, just a word about this procedure. This is not a sterile procedure. We're using gloves because we want to protect ourselves, but also our patient from any germs we have on our hands. But the vagina is not considered a sterile area. However, anything that goes beyond the cervical os, as in if there was a procedure that was going to happen into the uterus, that would have to be done in a sterile manner. All right, so we're ready for our examination. I'm going to review with you. First, you would want to look at the external genitalia and see if there are any abnormalities. Now, a patient may come in for a screening pap smear, and you're performing this examination, which is what we're doing today. Or they may come in because they have a complaint. They have a vaginal complaint, a pelvic complaint, or a lower abdominal complaint, in which case a pelvic exam may be necessary. And that's more of a focused examination for a particular complaint. But today, what we're doing is we're doing a screening pelvic examination and pap smear. Does that sound good? All right, so I have put my gloves on. I have draped my patient. She is in the lithotomy position. I have already obtained informed consent, and we're going to start the examination. For purposes of this video, I am not putting lubricant on the speculum or my hands so that I don't need to clean my model afterwards, but just know that either using some warm fluid on a metal speculum can make it more comfortable, not hot of course, because speculum can be cold and uncomfortable for our patient, or we could use the lubricant in addition or instead of, and the same thing goes if you're using a plastic disposable speculum. It just allows for the sliding of the speculum into the vagina with less discomfort. So we look externally, and just to keep in mind, in this model you can't see a labia majora or minora or the clitoris, but just to keep in mind where everything is, that's the anus right here. So we want to make sure that as we're doing this examination, we're not causing discomfort with the instruments that we're using. So we're explaining as we're going along, and we are inserting the speculum after lubricating it in this fashion so as not to pinch the labia. Your checklist also says that you can separate the labia with your hands. Put some posterior pressure, which is less sensitive, and then insert in this fashion. And with a model, you may need to use a little bit of force because it's a stiff model, but we never use force with our patients, okay? And then after we've inserted it in this angle, we turn it horizontally. And these clasps, we press these clasps open after it's been fully inserted in order to visualize the cervix. Then we lock it in place using this lock, and we have a good visual view of the cervix. And I'm gonna get the camera closer so you can see the cervix and what I'm seeing. Here we go. And that's the camera, and I'm gonna get my light source so you can see the cervix. Hopefully you've been able to see that. And I'm gonna bring you back here again in order to continue this video. All right, get everything set up here. Okay, there we go. So we have the cervix. Let's say we are noticing vaginal secretions. We're concerned that there might be an infection, a bacterial infection or a yeast infection. We take our cotton swab. If we think there might be a sexually transmitted infection, we will collect a different kind of sterile swab that will be sent to the lab so that we're not introducing any bacteria. So this is non-sterile. We just get some of those secretions. We put it on a slide. We use the drops I mentioned for KOH for yeast identification, or normal saline for bacterial vaginosis. We put the cover slip on. Here's my cover slip. Now I've prepared that to look at under the microscope before the patient leaves the office. I might also use pH paper to check for the pH of the vagina to see if it's consistent with a bacterial vaginosis. So this is something you can do in your office. It's called point of care testing. And then of course you can take samples to send off to the lab for any kind of infection like chlamydia or gonorrhea. So taking our brush, we're going to insert the brush into the cervical os and turn it and kind of do this motion back and forth and turning to collect cells. And as you can see, this particular brush is designed in such a way that this would go into the cervical os, and this other part of the brush would collect cells from the outside of the cervix or just inside the cervix. So endocervical cells are what we're really looking to collect. And it's pretty easy and not painful usually, but some cervix can be tender, and so again, you're checking in with your patient. You can also notice some bleeding that happens that's not abnormal. Sometimes that can happen just normally, but it's usually the type of bleeding that stops right away. It's not something that you need to worry about continuing. If there's an infection or inflammation of the cervix, that might lead to a little bit more bleeding. This brush here is narrower. Both brushes work really well. They're soft, you can tell. And so I'm just going to demonstrate with my hand. That's like the cervix. And you're doing this sort of thing, going back and forth. And I'll try the other brush just to show you, give you an idea what this is like. You just go in like this and you swish it around. And then you've collected your cells. I'm going to do it right now in the model, and so you can take a look. So I take this, I go in. I do what I just showed you on my glove. And I've collected the cells. Then I open this little container here, and I'm not going to do it for the purposes of this video, but I stick this brush into the solution and then swish it around so that the cells will be collected in this solution to be sent off to the lab. Make sure you label your container with the patient's name and date of birth. Usually labels are produced at the front desk so you won't make a mistake. Patient's identification, medical record number, so that samples are not mixed. You never want to take a sample you've collected without identification out of the exam room. You want to make sure it's identified first before you take it away and send it to the lab, so there are no mistakes. After you've performed the vaginal examination and pap smear, we're going to remove the speculum and do a bimanual examination. So removing, first you unlock. Now let me say, I haven't said this, but let me say that as you're doing this examination, it's not just about collecting the sample. It's also about looking to see if you see anything that's abnormal. The cervix should look smooth, and sometimes you see prominent glands. You'll get used to these types of normal appearances of the cervix over time, but you don't want to see a mass there. You don't want to see any irregularity of the cervix. So pay attention to what you're doing as you're doing the examination. I also look at the vaginal walls in addition to the secretions. And so just get an idea of what normal is, and then when you see the abnormal, you'll know. Sometimes there could be benign findings like a cervical polyp, a little growth inside the cervical os. It's usually very smooth looking, very red, polypoid, and those are generally benign, nothing to worry about. You can refer to a gynecologist to remove the polyp and send it off for pathology, but generally they're benign findings. All right, so releasing the speculum, and again, talking to your patient, letting them know what you're doing. And then now, of course, the speculum is around the cervix, and we want to gently pull it off the cervix. And then turn the speculum, keep it closed. Closed means those little clamps are farther from each other, and then you remove it. And there you have it. You've done your speculum exam. This gets sent off for cleaning and autoclaving. A few other words of caution. We did mention the labia, not pinching them. The clitoris sits right here. It's very sensitive. So as you're inserting the speculum, you want to really go down and create room for it. We did talk about spreading the labia, but also producing some downward pressure towards the rectum, which is less sensitive. And so you just be cautious about where things are. And again, expecting the external genitalia gives us a lot of information too. There may be lesions. There may be lesions like ulcers or polyps, maybe growths like warts. So just look on the external part. Make sure you understand what's there and what should be there and what shouldn't be there. And then there's, of course, the rectum. So here I'm going to do the bimanual exam. What do I do here? I lubricate 2 fingers. Now for this model, it's very stiff and 2 fingers won't fit in there, but I will lubricate 1 finger. I pretend that I've lubricated 1 finger, and then I'm going to do a bimanual exam. What does that mean? When I do a bimanual exam, I'm feeling for any abnormalities of the cervix itself and the adnexa and the uterus. Okay, again, if this is problem-focused examination, a patient is complaining of something, that examination may be more detailed towards the problem. And if it's not, I am trying to feel normal structures. So there's the vaginal wall, there's the cervix itself, and all around the cervix. I move the cervix just to get practice on moving the cervix, just using 2 fingers in this kind of motion for the cervix to see if there's any cervical motion tenderness. If there is, that might suggest some pelvic inflammation, maybe a sexually transmitted infection. So have some idea of what that's like. Now, cervical motion tenderness, might be uncomfortable, but tenderness really means that somebody's really uncomfortable, like the chandelier sign, somebody says, ouch, that really hurts. So pay attention and ask the right questions. And then we move to each side, the right and left adnexa. And moving to the right and left adnexa, what we do is we're putting our hands, the fingers that are in the vagina on the, let's say, the right side of the patient, and my hand on the outside of the patient pushing down. So we're doing this motion here for the patient, and sometimes like a milking motion to feel the ovary on that side. Does it feel normal? Does it feel large? Does it feel like there's a mass there? And we do the same on the other side. Additionally, we do an examination of the uterus. And again, it's this kind of motion to feel the uterus. And I'm going to demonstrate that for you, but I think my back may be to you when I'm doing that, so it might not show up that easily. So I'm going to turn my model and see if I can give you a side view of this examination. Of course, this is artificial, turning of your patient. You wouldn't be doing that. I'm just doing it for the video. And I'm pulling away all the other items I have on the table so that I can perform this examination for you. And this requires that I, again, lubricate my fingers. I'm doing one finger at the moment, separating the labia, putting one finger in, feeling the vaginal wall, so all around. And then I am, usually do this examination standing up. I am feeling the adnexa, after I've felt around the cervix and around the vagina. I feel one side, and then I feel the other side. I feel the uterus, what size it is. I've checked for cervical motion tenderness, and then I remove my fingers. So I'm asking the patient if anything hurts, but in general, I'm really more monitoring if the patient looks like they're comfortable or they're uncomfortable. And then I finish the exam with a rectovaginal exam, which allows me to feel behind the cervix with my 2 fingers. Again, lubricated fingers, 1 finger in the rectum, 1 finger in the vagina, and I'm putting my fingers together in the fornix, in the back of the cervix. And that concludes the examination. I'm going to show you what I have on the table one more time so that you understand what is my prep. So here you have the PAP material, the drops if I need them, the cervical brushes, the slides and cover slips. Here we have the different size speculum and the lubricant. Okay, I'll bring you back over here. All right, so for our patient, we conclude by explaining what has been done. First, we leave the room with our slides to evaluate them if we've collected slides. We want to make sure that we close the visit by explaining everything that's been done, when they can expect the results for their tests, their pap smear, their cultures, if we've taken any, their HPV, human papillomavirus test, and when they would expect to hear from us, and what kind of follow-up would be necessary if there's an abnormality. So this kind of closure to every visit, giving them the opportunity to ask any questions, I think is really important. So I hope that this has been very helpful to you. I will see you all in class, and I wish you a great day.